Hypertension is the elevation of our blood pressure. We need to have a blood pressure so that the blood will go to the different important parts of the body. The normal blood pressure for the general population is 120/80. So we call it hypertension or elevated blood pressure if it goes around 140/90. In the Philippines and globally, the awareness of the general population that they have hypertension is only 50% and less. Unfortunately, of those 50%, 20% are under control. So this is a very serious problem for the government, for the society, because the complications will increase the socio-economic needs of the government. The complications are heart attack, stroke, disability from stroke, kidney disease that will lead to dialysis, and other things. There are two kinds of hypertension. One is what we call primary hypertension. The primary hypertension, yun yung hypertension na nalalahi natin. Pag merong nanay, tatay, and other relatives, that's the primary hypertension. If you're a smoker, the blood vessel will be thickened and bad. And then obesity is another, inactivity, walang exercise. What we see in our survey, many of the Filipinos who are in their 20s are already suffering from hypertension. Let's give an example. If a person develops obesity and the person does not have family history, so the hypertension came from the obesity. So if the person attends to the weight and gets her or his ideal weight, yun, we can say she was able to cure the high blood pressure. But when the person has a family history and then developed hypertension and then took medications and the medications controlled the blood pressure, that's what we call not curable but controllable. So when we say controllable, you have to continue the medication, you have to continue the healthy lifestyle, lifetime. In 2012, they passed the sin tax law. The sin tax law is putting extra tax on cigarettes and alcohol. In the 2018-2019 research survey of the government, they were able to show that there is decrease in the consumption of cigarettes among the population. So I guess the sin tax law is working. And the blood pressure prevalence is also decreasing. So both the cigarette consumption and alcohol consumption of the community decreased, I think, because of that sin tax law. First, we did research and we came up with these numbers. These numbers will be used by us to lobby more laws. Since we saw that sin tax law was effective, now we will be lobbying for a low salt intake law. The high intake of salt, sausaw tayo ng patis, bagoong, asin. Almost all stroke patients had that experience before their attack. They took something very, very salty or had a very stressful situation before they had the attack. So soon we'll be lobbying that low salt intake law should be put into legislation by our government officials. That's one. Number two, the Philippine Society of Hypertension is establishing several chapters all over the country so that our programs, lectures, community activities will be implemented to increase more awareness from the population. Kasi we do not wait for something that we will feel. We have to see to it that our blood pressure, without us feeling bad, will be checked and controlled accordingly. It is not anymore a doctor-patient problem. It is more than that. It's gigantuous. It is the community. It is the country. So, if the problem is as big as that, it is only law that can make each individual Filipino who will be aware and who should be following. Iba kasi pagbatas eh. Pagbatas, sinusunod talaga. So, we've seen a lot of programs coming from doctors ourselves, and sometimes it's taken for granted kasi pang maliit na groups lang. But if it is way above us, which is government and which is batas and law, that one should be followed, and the people who will be following will be the whole country and not anymore just a mere community. When you are told that your blood pressure is high and it will be lifetime, hindi kayo tinataningan. Para lang yan may allergy ka na ikakamatay mo kasama mo yung allergy mo. What we're trying to say here is you just have to control, because to suffer from heart attack, stroke, dialysis, for me is unforgivable because it is preventable. The partnership between you as patient and us as doctor is 50% success yan. And again, hindi po kayo tinataningan pag kayo po ay hypertensive. Iko-control lang po natin and you will live a happy, complete body life.